Some stories don't stay with you because they're shocking. They stay with you because they're puzzling. And Wendy's? Yeah, Wendy's was one of those. Now, this isn't the story of some celebrity or some headline-grabbing case. Wendy was just ordinary. Ordinary except her life revolved around being ill, or at least convincing people she was. Her medical file? If you stacked it up, it could have doubled as a coffee table. She'd been everywhere. Hospitals, clinics, walk-in centers. You name it. And every single time, she showed up with a brand new complaint. 1 month, it was unexplained chest pain. A few weeks later, severe stomach cramps. Then dizziness. Then numbness in her hands. And here's the thing. The symptoms would vanish almost as quickly as they appeared. Always replaced by something new. Doctors ran tests, blood work, imaging, the whole checklist. And time after time, normal. Perfectly normal. Now you'd think Wendy would be frustrated, or at least a little worried she'd never get answers. But nope, she was almost unfazed. Like the point wasn't to solve the mystery, it was to keep it going. And she was good at it. She could describe her pain with polished precision. Type of discomfort, intensity, exact timing, always just believable enough that nobody could call her out. At first, doctors chalked it up to bad luck, a string of minor issues. But then patterns started to show. Wendy never saw the same physician twice. She skipped follow-up appointments. And her visits? Frequent, weekly, sometimes more. Eventually, someone said it out loud. This wasn't about illness. This was about attention. Her first known hospital visit, she claimed crushing abdominal pain had woken her in the night. GP rushed her to A&E for possible appendicitis. By the time she was examined, the pain had shifted to her lower back. Tests were fine. She was discharged. 2 weeks later, she popped up at a different hospital. Migraines this time. She described them perfectly. The triggers, the sensitivity to light, the way it built up. Believable enough that she got admitted overnight. And that became her rhythm. Just enough detail to keep things moving. Never dramatic. Always the polite, cooperative patient staff wanted to help. Over time, Wendy became a medical chameleon. She could slip into any waiting room and blend right in. Expression just pained enough to draw concern, but not suspicion. But if you paid close attention, there were tells. Nurses noticed how quickly she grasped medical jargon. She knew the difference between neuropathic and musculoskeletal pain. She tossed around words like differentials, like she'd been to med school. And whenever she sensed someone was catching on, she vanished. No confrontation. She just wouldn't come back for follow-ups. Instead, she'd show up somewhere new with a fresh complaint. Sometimes miles away. Sometimes a whole different city. It wasn't wanderlust, it was survival. Because staying too long meant people might connect the dots. And Wendy couldn't afford that. Not yet. Now, for most people, surgery is the last resort. It's scary. It's something you hope to avoid. For Wendy, surgery was the prize. It didn't happen often, and never at the first hospital she tried. She was patient, strategic. A minor procedure here, a biopsy there. Nothing major, nothing that would leave her bedridden. But always something that bought her days of care, attention, and recovery. The first time she got admitted for surgery, it was for suspected gallbladder trouble. She'd been talking about upper abdominal pain for weeks, and now it had flared. They found nothing abnormal, but she left with a neat little scar and several days of doting nurses. And she learned quickly. Surgery meant extra perks. The slow walks down corridors, staff offering encouragement, the hushed bedside chats, even bland food trays delivered like clockwork. It was all part of the ritual. By her third operation, she had the formula down. She knew exactly how to present symptoms. when to appear hesitant, and when to finally give in to surgery to make it look believable. Her body started to carry the map of her choices. Faint scars across her abdomen, small puckered marks near her side. She didn't hide them. If anything, she wore them the way some people wear jewelry. Quiet proof she'd been through something. But of course, surgery never solved anything. It couldn't. There was nothing to solve. What it gave her was the one thing she wanted most. Waking up from anesthesia to a room full of people focused only on her. But cracks were coming. The first sign was a junior doctor at St. Mary's flipping through her chart. He wasn't even looking at her latest results. Those were, as usual, fine. He was staring at the sheer volume. Dozens of visits, different hospitals, same urgent symptoms, same inconclusive endings. When Wendy returned a week later with sudden severe headaches, he pressed her harder. Not about the pain, but about her history. Have you seen a GP for this before? How many times has this happened? Where were you treated last? And Wendy had answers. Of course she did. But for the first time, her polished replies were met with polite skepticism instead of sympathy. Then came the real blow. Hospitals had started linking records across facilities. So when she walked into a clinic miles away, the receptionist's screen lit up with her entire history. Rumors spread. Nurses shared looks. Consultants lingered over her file a little too long. Her tactics faltered. Tests were ordered reluctantly. Procedures delayed. Waiting rooms got longer. And then one day, an older doctor closed her file and asked, "Wendy, what are you really looking for here?" She gave the same practice smile she'd always given. But this time, it didn't land. The walls were closing in. The final collapse came from a nurse who had worked in 3 different hospitals. She'd seen Wendy before, twice, in different towns, under different names. She didn't confront her. She flagged it. And within hours, a doctor ran a database check. The numbers were undeniable. 24 visits in under 3 years. Different regions, different details, same woman. By the time a psychiatrist was brought in, Wendy was in the middle of yet another performance. Sudden, crushing chest pain. But this time, no one rushed her to scans. They sat with her, asked questions, and introduced a new word into the room: Munchausen, a compulsive drive to fake or exaggerate illness for attention. She didn't deny it. She didn't argue. She just flickered, like someone had finally named the shadow she'd been living with. She started therapy. Progress was slow. Some weeks she skipped. Some months she disappeared. She wasn't cured. Maybe she never would be. But the hospital visits slowed. Years later, in an interview, Wendy admitted it. She called it a lonely way to live. She said hospitals felt like home, not because she loved being sick, but because she loved being seen. And when asked if she still fought the urge, she said yes. Some days she did, but now she knew the truth. And knowing made it harder to hide from herself. Some stories shock you. Wendy's doesn't. Wendy's lingers. Because it isn't about disease. It's about something deeper. That universal, uncomfortable need we all have. The need to be noticed.